Good morning, all. Today, let us see a topic in the subject medical electronics. The course objectives of the subject are given below. This we have discussed already. Next is the course outcomes. This also we have discussed already. Textbooks which are listed as below. We are into Unit 2, which is Biomedical Instrumentation. The topic for today's discussion is blood pressure measurement. You all know actually the pressure originates from the heart, in particular artery. So it is termed as arterial blood pressure. The BP or the blood pressure depends upon the cardiac output, diameter of the arteries, and quantity of blood. These three are the major parameters that decide the blood pressure. So as you all know, the normal value of BP is 120/80, which is expressed as mmHg, that is mercury. So 120 is systolic pressure, 80 is diastolic pressure. If you have a high BP, it indicates that you have the risk of heart attack and strokes. In case if you have a low value of BP, it indicates that there is an oxygen perfusion in the brains. And to measure the blood pressure, we have two major methods, which is indirect method and direct method. Blood pressure measurement. Hope you all have seen this kind of instrument in all the hospitals. Whenever you go for a general medical checkup, the first thing they do is they measure the temperature. Second thing they do is they measure your BP. Whoever it may be, man, woman, child, or whoever it is, they measure the BP. You could have seen this instrument in all the hospitals. It is called the sphygmomanometer. This is used to measure the pressure. This is a simple diagram which tells us how they measure the pressure with our hands. As you can see, imagine this as a patient who is stretching his arms like this. Blood from the brain or the heart, blood from the heart flows from the through the arteries to the tip of your fingers. So here a cuff will be tied on your arms, which is inflatable. That is, you can push in air into that. It is a rubber cuff. Attached to it, there is a bulb which you can squeeze so that air goes inside. The air is measured using the measuring instrument, and there is an air valve which regulates the flow of air here. The doctor or the nurse will have the stethoscope here and the sounds are heard here. So here the artery is given in the diagram as below. So when you see there is a mercury column here wherein it shows the BP levels in terms of the levels of mercury. So here when you take systole is the first pressure which will be recorded, and diastole is the second pressure which is being recorded. So when you see here, the nurse or the medical practitioner will try to pump in the bulb so that air goes inside this rubber cuff. As air gets inside this rubber cuff, it will shrink or compress your arms so that blood flow through the arm is constricted or restricted. So when blood flow is restricted, there will be no sound. Okay, because your artery is closed, because you are closing by applying high pressure of air. So you would have noticed that the bulb the medical practitioner will that he or she is holding, they will try to release it on. When they release it, slowly the air pressure drops, which you can see from the mercury level. At one point of time, say near 120, the artery will start to open and close because you're not permanently opening it. So there will be a sound that you can hear. That indicates the systolic pressure. At the time, they will observe this reading. Then in due course of time, when the pressure is further reduced, the artery becomes normal, it doesn't close. So since it is open, at one point of time, the sound will vanish. So the first reading at which the sound vanishes is taken as diastole pressure. You can better understand with the next diagram. You see here there is a normal blood flow. There is no restriction. So your hand gets the full blood flow. The second point wherein a cuff is tied to your hand, through this bulb that is called actually sphygmomanometer, you apply pressure. So what happens, this cuff pressure will block your blood flow. So what happens, your blood does not go through your hands. So it is stopped. Now when you leave that bulb, that is you don't pump, you just leave it, what happens is that pressure drops here. As you can see, the pressure is full here, the pressure drops here. That time when you take your stethoscope and keep it near your elbow, you can suddenly hear a sound or a pulse kind of thing wherein your artery just opens up. That pounding sound is recorded to be systolic pressure. This happens because systolic pressure is greater than cuff pressure. The last diagram is the pressure further drops. At one point of time the sound stops. You cannot hear the pulse. So it means that entire blood flow is normal. There it is called as diastolic pressure. This is how you are being measured with your blood pressure at different hospitals. Hope you are clear with that. So as I said, it has three parts: a cuff which can be inflated with air, a pressure meter for measuring the air pressure, a stethoscope for listening the sound. And the scale of the pressure meter ranges from 0 to 300 mm in terms of mercury. Okay, so to measure the blood pressure, as I said, the cuff is placed around the bare and stretched out upper arm and inflated until no blood can flow through the brachial artery. Now the air is slowly let out of the cuff. When the pressure falls below the systolic pressure, blood starts to flow into the arm once again. So there you will hear a pounding sound where the arteries close and open. So that sound can be heard by using stethoscope, as I already mentioned. So when you hear the sound for the first time, you should record it as systolic blood pressure. Later, when the sound stops, we can know that is diastolic pressure and we should record it. Now the blood vessels remain open. That pounding sound is called as Korotkov sound, or it is also called as heart sound. Hope you are all clear with the blood pressure measurement today. Thank you.